Hello everyone, welcome to my channel, and in today's video I'm going to discuss a 7-step approach of managing STI in a GP setting. Okay, so let's suppose you are working in a GP setting as a junior doctor and a patient presented to you with sign and symptoms of discharge down below, and you've taken your history, you've done the examination, and you've come to the conclusion that this patient has a sexually transmitted infection, probably gonorrhea or chlamydia. Okay, so let's come to the management, how you are going to provide management to this patient. Okay, so the first step here is explaining the condition to the patient. So remember that in PLEB 2 exam, the management of the patient starts by explaining the condition to the patient and checking their understanding whether they have understood or not. Okay, so in simple words, you will tell the patient that from what you told me and from what I understand, it seems like you have a sexually transmitted infection of your reproductive tract. And the next step will be addressing any ideas, concerns, or expectations that the patient might be having. Okay. So for this, you must have asked ideas, concerns, and expectations after taking your history. Okay. And then in the management part, you will be addressing them. The third step will be telling the patient that you will take some swabs for testing to see which bug is causing this infection. And you will also, in the fourth step, you will also encourage them to go to the genitourinary medicine clinic to get screening for other STIs like syphilis. So basically, some STIs like syphilis, the screening can only be done in a genitourinary medicine clinic. Okay, so you will encourage them to go there, and you'll tell them that it's a walk-in clinic. You do not need to, do not need to book an appointment. You can just walk in there, and they will get your tests done. Okay. All right. Now we need to give antibiotics to this patient empirically. We've taken the swab for testing, but we need to give them antibiotic empirically, and we will treat this patient both for chlamydia and gonorrhea. So you'll tell the patient that I'm going to give you some antibiotic medications. It will include a single antibiotic injection and a single antibiotic pill. Okay, so basically the injection is ceftriaxone 500 milligram and azithromycin 1 gram. So I will recommend that remember the name and remember the dose because the patient might ask you. And you don't, if you tell them I will give you antibiotic, that's okay, but it's better to explain to them properly that it includes a single antibiotic injection and a single antibiotic pill. And even you can even tell them the name, that the injection is called ceftriaxone and the antibiotic pill is called azithromycin. It will be better for the patient's understanding, and the examiner will come to know that you know the protocol here. Okay. In any other infection other than STI, we just say antibiotics according to the trust guideline. So we'll tell the patient that we'll give you some antibiotic according to the hospital's protocol or according to the trust guidelines, because the antibiotic protocols differ from hospital to hospital. But in case of sexually transmitted infection, this is recommended by NICE, and it's used all over the country. Okay. Now, the sixth step. So now you are done with the patient. Okay. Now you're going to think about their partner. So always remember that in STI, you need to treat the patient and you need to treat their partner. So if you have treated the patient and you have forgotten about the partner, then you will only get like 2 marks in the management out of 4. Okay. So always remember to treat their partners as well, to think about their partner and mention it in the management. So you will advise the patient to use barrier methods, that is condoms, until the treatment is completed and a test of cure is done. And you'll also advise them to discuss with their partner that they've been diagnosed with an STI. So the partner can also go and get screened for STI in a genitourinary medicine clinic, and also get empirical treatment for the STI. Because in case of chlamydia and gonorrhea, we also treat the partner. You need to let the patient know that if the partner is not treated, then even if he gets antibiotic and the symptoms disappear, he will get the infection again from the partner, because the partner might be having the infection. And even if they're not having any symptom, the infection might be silent, and it can even cause serious complications like infertility or pelvic inflammatory disease, which is a much more serious infection and requires hospitalization. Okay. But if the patient is reluctant in telling their partner, you will offer partner notification program. You will let the patient know that we have this partner notification program in the NHS where we inform the partner anonymously that they have been exposed to a sexually transmitted infection and they need to get screened and get treated. Okay. But please do remember that the patient needs to consent to for this. Okay. You cannot just let the partner know without the patient's consent. The patient need to consent to the partner notification program in STIs like gonorrhea, chlamydia, syphilis, other than HIV. You need the patient's consent for the partner notification program. And also the patient need to give you, if you think in practical approach, you need to get the name and the address of the partner in order to let them know by partner notification program, and the patient need to tell you that. So this is just the practical aspect of it. But in any other STI other than HIV, we need the patient's consent to inform the partner via partner notification program. So this was the seventh step approach for the treatment of STI in GP setting. I hope it was helpful, and I will see you soon in the next video.